Pretty sweet. I'm Brice Hancock, and I'm here with Parker J. Smith. This is Mile High Recovery Chat, and usually I don't know the guests that well, but I do know you well. You are a consultant for treatment centers, for behavioral health centers, right?
Yeah, and even like outpatient office-based surgery centers now, and other parts of healthcare beyond the behavioral health side.
All right. And so what happened is, my story was I owned sober livings, and I got in a kind of a fight with the city of Denver, and they said, you got to stop opening up sober livings. And so I decided to open up an outpatient treatment center. And I went to, I guess somehow I connected with Keenan, and you were partnering with Keenan, and you helped me open my outpatient treatment center. And I'm going to read just a snippet from your website. It says, your mission is to support the growth, development, and refinement of behavioral healthcare organizations striving to make a positive impact on the lives of others. And I believe that about you. I believe that you are doing it for the right reasons. And I believe I'm doing it for the right reasons. And I think a lot of people, they want to open up treatment centers, or they want to do these kinds of things. There's a lot of detail that goes into opening up a treatment center. An unbelievable amount of detail and policies and procedures and things you got to know, right? Yeah. And so let's talk about how you got into it. You're not, and I know that you're like, sometimes you feel sensitive about this, but I don't think you should. You're not in recovery, right? So that wasn't like why you got into it, but I think that maybe gives you more credibility, because you're just doing it from a place of, you just want to help people.
I do. Yeah. I do want to help people, and I've always wanted to help people. And what brought me in this direction was when I was in college, a handful of my best friends all started shooting up heroin every day in the house that we lived in together. And I felt very powerless to the situation. I had no idea how to help them, who to talk to, how to help at all. And once I had graduated, I felt like I had a direction to go in my desire to help people and connect with others. And so I started on the CAC process right after I graduated. It's called the CAT and the CAS now, but it used to be the CAC 1, CAC 2, and CAC 3. So I have my CAC 2, which is now the CAS, Certified Addiction Specialist. So initially I thought I wanted to be a counselor or a therapist. And my first job out of college was with outpatient organization called Center for Change, which provides court-ordered classes for domestic violence, DUI, criminal offenses, more or less. So nobody wanted to be there. The owner was a very jaded woman. She did not treat me very well at all. And I realized quickly that this place was not for me. So I remember applying to 40 jobs a day in the industry, out of the industry. I wanted to continue to pursue the CAC, and the biggest part of that is gaining the work hours. A lot of people have to volunteer for them. They can be very difficult to get. So I did try to look for an employer where I could build those up over time. In one of the 40 plus jobs I applied to, one of them was through Craigslist at a company called North Star Transitions. And back then, this was, I think, 2013, North Star was a recovery coaching program. And it was Mike Farrell, who's the founder, Cody Gardner, who is now the CEO of Red Point Center, and myself. And we had our staff meetings outside of office buildings in the front courtyard because we didn't have the money to even rent office space. But that organization obviously did very well. We earned our IOP license, PHP license, and then we actually opened the first state licensed residential treatment program in the city of Boulder, and multiple after that. So what I learned at North Star, probably more than anything else, was resourcefulness. Mike is a very ambitious guy. He was very interested in growing quickly and was more or less, putting a good amount of the, operational work onto me, which I accepted with honor. You know, it was an amazing learning experience to be the director of operations there. First, I was a recovery coach, then I was a program coordinator, then I was a director of operations. Austin Eubanks was the director of operations prior to me, and he was, you know, one of the more influential people in my professional career. He mentored me. He had known that he was going to start telling his story and do the TEDx stuff and work for the Foundry 6 months before he left North Star, and didn't tell anyone, but was really building me up to be a leader, empowering me, you know, during that period of time. And without his tutelage and Mike's and Cody's, I certainly wouldn't be, you know, where I'm at today. So I'm very blessed to have had that opportunity. As part of my role, obviously compliance fell under my umbrella. I managed our state license and earned, you know, state licenses for all the different levels of care. And then when we pursued joint commission accreditation, it kind of all fell, you know, all the different 15 chapters kind of fell on my plate, which I may have been resentful about at the time, but I'm more than grateful for at this time.
So for the people that don't know, so you switched. So just let me just first say that that's quite a crew of characters and strong personalities. Mike Farrell is just a total character, and Austin Eubanks clearly, and Cody
Rest
is
in peace.
too, right? I mean, those are some strong personalities. Those are all leaders, right? Alpha
Yeah.
males, as it were. And you switched from a clinical role to an administrative role, essentially, or do you call it
Hmm.
operations?
Either or.
All right, so you're no longer counseling; you're dealing with like policies and procedures and rules and how well you play patty cake with the Office of Behavioral
Mhm.
Health. Correct?
Yeah, and the parents, right? Like of the client. So I think one of the more difficult parts of the administrative side is, you know, when something happens to a client, maybe they're in sober living and they relapse, or, you know, they slip up or something happens. Um, Inevitably you have to have a conversation with their family to talk about next steps, and, you know, that family's hurting, and there's just a lot of unique challenges that definitely fell into my lap that I'm very appreciative of all of those experiences, and being able to suffer through those, some of those challenges, but also the victories as well. And, you know, Cody, Austin, Mike, I got to also throw Keenan Vandebogard in the mix. He's, you know, been a huge influence in my life, and he's the current executive director of North Star. He's taken it far beyond what I would have been able to. But yeah, very strong men, strong personalities. You know, clashes over time that we've had, but
I bet it was
you know,
hilarious.
all
I
for the
bet you guys
best.
had so much fun. I just can't even imagine like how much fun you guys have. Like Mike cracks
It
me
was a
up,
lot.
and Cody
Yeah,
cracks
we
me up. Yeah,
a lot of laughs, and
yeah.
a lot of laughs now, especially looking back and just being like, gosh, shit was crazy.
And Keaton is one of the smartest, like most thoughtful CEOs that I know in the space. He always has a good answer.
Brilliant.
Always has a good answer for everything I've ever asked
Yeah.
him.
Yeah. And what
Yeah,
I'll say about all of those men, which I appreciate more than anything, and the only reason I, you know, went shoulder to shoulder with them all for as long as I did, is they're in it for the right reasons, you
certainly,
know, to help people. And
certainly.
I believe that that's really the core of it. You know, if you're coming into the industry to make money, you probably shouldn't be in the industry, because although there are those opportunities, you know, if that's at the forefront of your mind in this type of industry, then you're just not going to do good work. Someone told me one time, and I really appreciated this. It's easy to make money or provide quality care. It's hard to do both, and that's really what the, you know, some solid treatment centers are able to do. But it's very difficult. It's very challenging, and if
So
you
let's
have the
have
right
some
kind of
fun.
mentality,
Let's have some fun.
cool.
Let's talk about that. So my understanding is that it's, you know, treatment used to be private pay, and then in the 80s, I believe it was called parity, where insurance companies, you know, if they're going to treat people with depression or anxiety, or with, like, you know, physical medical health, some politicians came along. I believe it was Ramstein from Minnesota, and said, you have got to treat people with substance use disorder too. And insurance, is that what happened? The laws changed, insurance companies agreed. All of a sudden, you can make a lot of money treating people with substance use disorder.
It's a combination of things for sure, multi-factor influences, but, a lot of the different stakeholders, I think, finally said, like, these are the people that we need to also treat with respect. I think the insurance companies saw that they were paying more bills over time in the emergency room and in doctors and all that. And so they said, we're going to pay for substance abuse treatment services with the intention of avoiding claims later on, because insurance companies are more or less just calculating the cost benefit analysis of the services that they're willing to authorize in relation to what will happen to the future of that subscriber based on all the research that they've done at their time and all the data that they have to support those decisions. So
it's an interesting industry in many ways. One
yeah,
is that, to be a licensed counselor or a therapist, you're regulated by DORA. You have to meet ethical standards. You have to have a certain degree, and to be a CEO like myself, there is no licensing. I don't have to do anything, and it's a shame in a way, because that means that, like, straight up criminals can become CEOs. They can become marketers because they're not licensed by DORA. The therapists are, right, and so some unethical, business owners and CEOs are employing licensed therapists, and that's tricky.
Yeah, what's especially tricky, I think, about it too, is I think that there's a lot of people that really do get in the industry with the right intentions, and they have their own, personal connection to it. But to be able to own and operate a financially solvent business, in a lot of ways, you have to see your customers as customers, and that's where it can start to get tricky because they're people and they're suffering. And according to the Americans with Disabilities Act, they're disabled. So it gets tricky for sure. And
Yeah,
there are a lot of bad players, and there's also a lot of good players too.
it's tricky, and like, people misunderstand me. If something's not profitable, it's not going to be sustainable, and then nobody's going to get help, right?
Unless it's subsidized, by CMS or the,
Sure.
SAMHSA through grants and all that, because there's plenty of treatment providers that are not making profits that are still definitely making an impact.
Right. And you can do that. But like for something like Mile High Continuing Care, my treatment center that you guys helped me start up, we're grassroots. We It's a group of people, and we're living the 12th step. We're doing this to help. I thought that was the goal, was to get people well. And I've learned that that's not necessarily everybody's business model. It's not. Like, in some people in the continuum of care, certain parts of it pay more than others, right? And so there's there's a, how do I say
And
it?
it's always changing too.
It's
That's what
always changing.
complicated
It
it.
is always changing. But like, if you own a detox, you're getting a lot more money per day per client than you are at, say, IOP or general OP, right? And insurance
Mhm.
won't even pay for sober living. It's just the way
No,
it's set up. That's just the way it goes.
for now.
For now, right? That's just the way it goes. So, right. So you don't work with certain, like, you have turned down clients because you didn't believe in their ethics, correct?
Yeah, early on when I started my business, I missed meals because I had to turn down certain business for the sake of my own conscience. I mean, I came into the industry wide-eyed. I was under the impression that everybody was in it for the right reasons. And then 6 months into the work, I went to my first conference, the Winter Symposium, and was like, not all these people seem to be motivated for the same reasons.
Right.
But yeah, I take a lot of pride in the projects that I take on, take a lot of pride in my work. I really hang my hat on the integritous nature of the way that I choose to live my life. And there's a vetting process that I go through to better understand the people and the program. because it's tricky, like you said out there, and very proud of the clients I have been able to serve, the active clients that I currently work with, and yeah, they're doing well.
Yeah, and I use the word tricky because I don't want to. I don't. I'm not a whistleblower. I'm not. This isn't 60 Minutes. I'm not trying to expose the industry or anything, right? As a CEO, it's difficult for me because I can't. I have a tough time competing with some of these, organizations that have millions of dollars to like spend on, SEO or on, like they have like
Google AdWords. Yeah.
Google AdWords and 5 marketers and, all this kind of crazy stuff. And that's okay. Like I accept the challenge, right? But there's like a huge disparity between what works and what we're selling. When I say we, I mean the industry, what we're selling. Where did the 30-day model come from?
That's a good question. It's a good question.
Yeah.
Probably from, a business mind, I would imagine. But I don't know the answer to that question.
I don't know either. I heard it was like a military thing, and
All
that's
I know is that the industry is going away from it now.
right. Okay, so right, like so it's like let's say your loved one is on drugs and they're sick and they need help and their friends have overdosed and died and you're afraid that your loved one's going to die. You can't call up a treatment center and get any, like, I'm going to send my son there. I know it's $1,000 a day. What are your outcomes? Like what are his chances of staying sober? Give me a number. You're not going to get that number, are you?
You're not. But
It's a
that's
tough number.
also, yeah, but that's also where our industry is heading, and for good reason, right? Is outcomes-based care. So you see, a lot of the different regulators demanding and requiring, quality improvement and outcomes tracking, so that we can actually start to collect data and aggregate and report it based on diagnosis, based on modality of treatment, and based on the administration of evidence-based tools or instruments like the PHQ-9, distress tolerance scale, the BAM, the BEC. There's all these, and so I think we're heading in that direction. That at some point, and this is probably the case already for a lot of treatment centers, they're able to say with individuals that are coming in with this diagnosis of substance use disorder, moderate, and general anxiety disorder, we provide these modalities of care, and 76% of our individuals report feeling XYZ less triggers on the craving scale or whatever it is. So you're right, that's a challenge, but this that's what part of what I'm passionate about in the work that I do is how do we measure success? That's very difficult because it's very difficult for every person in their own unique path. So someone that maybe comes to a treatment center and leaves after 15 days because they want to go use again, versus the person that comes and stays the whole 30 days and does great, that first person might find their own path and get what they needed out of that first 15 days and have a successful sober rest of their life. And the other person might, go right, be okay for 6 months and be sober, and then go right down and then overdose and die. So it's like, just finishing treatment is not a good barometer of whether it's been a successful treatment episode or not.
Agreed. And I talk about that a lot on this podcast or show or whatever you consider it. Like some stats that we can like zero in on are the doctors and the pilots program, right? And it's a 5-year program, and they have a 90% success rate, 94% success rate. That's pretty good, right? But it's a lot of accountability. They get UA'd for 5 years, and they really want their jobs back. They really want their jobs. Yeah, right. And so when a parent is on the phone and I can hear the pain, and I know they're sitting there with a pen and a yellow piece of paper, and they're writing down everything they can, and they're calling as many places as they can, and they're telling me they need to get their kid into treatment, what they really want is for their loved one to have a good, high quality life. right?
Yeah.
And to live and to have happy moments and to be around in a year and in 5 years and
Mm-hmm.
for a long time. That's what they really want. But they think what they need is, treatment. And it's a nightmare. It's very confusing for a parent or a loved one to try to get somebody into treatment.
Yes.
Yeah, and there's a lot of liars out there too.
Yeah, and it's like, a perfect example of how tricky or difficult it is like, if you Google the name of a treatment center, typically another treatment center is buying AdWords for that one.
Yeah,
So like you could type in Harmony Foundation and like some other, Recovery Village at Palmer Lake shows up as the first one. And it's
yeah,
like, for a parent who's seeking information, that's seeking, an understanding of, what the right type of facility is. I mean, they're getting taken down lefts and rights that they,
yeah,
didn't even know existed. And that's unfortunate because
yeah.
they just want their loved one to be healthy and happy and independent and part of a larger community that supports them. And yeah, the treatment is not always going to be that solution for reaching that life for sure.
Maybe it is, maybe it's not, right? But it's kind of like
Hmm.
what is the insurance card in my wallet? What does it say? What am I pulling my insurance card out? What what are they going to offer? What are they going to pay for?
Yeah.
Like that has to play into it too, right? And that's even confusing to find out. Right? So I mean,
Yeah.
residential treatment, I think the average is 18 days is what insurance will pay for now, right?
I'm surprised it's not lower than that at
It
this
might
point.
even be lower. That means the family's going to get stuck for the rest, probably cash, about $1,000 a day. And I'm just ballparking it. And I'm not saying you
Yeah.
shouldn't do that. I mean, God forbid one of my children was sick. I would throw money at it all day long. But I also want to throw it, there's a finite amount of money for every family. Um, and what really works, right? Like, what's the best way for me to, like, how do I spend that money the best, right?
Yeah.
Is it 30 days of
It's
treatment?
impossible to know.
I know it's impossible to know, right?
I would say honestly, from my perspective, most of the best resources are free.
Yeah, right.
Because the community, whether it's AA or NA or, smart recovery or whatever different, recovery community it is, they're very welcoming.
Yeah,
They're very supportive. They're willing to, volunteer their time for others to help them out. And there's even, organizations like Parents of Addicted Loved Ones, which I'd love to talk about at some point during this conversation. It's a pretty cool nonprofit organization. I think it's a little less known in Colorado, but they're in almost all 50 states now. So yeah, it's, I'm like we've talked about, I'm not in the personal story of long-term recovery from drugs and alcohol, but what I have noticed in my time working in the industry is it really comes down to communities. Finding a community of support is paramount for the, process of,
it was for me. I mean, people call me on the phone and they're frustrated and sometimes they're angry and they don't have any money left and they just say the healthcare system is broken. No one's going to help me. And I just tell them, dude, AA is free. Go do something. Like, you got to do something. What doesn't work is doing nothing or continuing to do drugs. Go to AA. Just go to one meeting.
Yeah, Phoenix Multisport, I think, is still around,
There's a
right? They're free.
ton of
Yeah.
free communities, right? And like this is like my own personal philosophy, but like Earl Hightower, he's an AA speaker, and he's an interventionist, like a pretty big interventionist, and he takes people to treatment centers that break down their resistance to 12-step because that's what he believes is going to keep them sober in the long term.
Yeah,
So I don't know.
definitely works for a lot of people. That's for sure.
Um,
Definitely works for a lot of
yeah.
people.
And so another thing you do, like, what do you enjoy the most about what? Like, do you enjoy setting up treatment centers? Do you enjoy coming into, like, a situation where, like, it's a family or uh, people that have the right intent, they want to help people, and they just need
Hmm.
it tweaked? Do you enjoy tweaking? Do you enjoy the JCO audits?
I do love a good accreditation survey.
Oh man, it's so exciting.
I'm the only one. Everybody
Yeah,
else is
you
like,
are.
oh my gosh, this is the worst. I'm like, this is awesome. Like, we get to learn more and grow and better understand what quality and performance improvement looks like. But I do like working with organizations in their early stages because it's so complicated and there's so many different components that you just wouldn't understand unless you went through it or you hired someone like me that had experienced it firsthand. I would say what I'm most passionate about is patient safety. I think every patient or client that goes through any program deserves to be treated with safety as the number one priority. To do no harm is what they say in our industry. That's priority number one. And I think some treatment centers can unintentionally, trigger trauma or whatever. So patient safety is a big deal for me. And then quality improvement. I mean, I'm a firm believer that nothing stays the same. Either it's going one way or the other way, and it's compound interest one way or the other. And so for the organizations that choose the path of continuous quality improvement, not only for the sake of satisfying the regulatory standards, but to genuinely try to improve on what they're doing using data collection, using, mitigation strategies and activities, taking that aggregated data and looking at those reports objectively and then collaborating to say, what can we continue to improve on over time? That's what gets me excited. And those are the types of people that I work with, is that, yes, they need their accreditation, they need their license. It's a linchpin for being able to operate a business and generate revenue, especially at this point in time. But, the types of organizations that are just really interested in continuing to improve what they're doing, that's what I really like to be a part of. And then I also like to be a part of, organizations that have been around for a while. Like, I was blessed to work with Harmony to help them with their license renewal and their CARF renewal. And I learned more from them than they probably learned from me. I mean, Annie Peters was their previous chief clinical officer, compliance director. She works for NATAP now as like the national outcomes and quality improvement person. She set up the most beautiful foundation of compliance that I've ever seen in an organization. And I learned so much from the work that she did, even though that she wasn't still there. And that's a really cool experience as well, just to, see the different ways that people do different things, and then, download that information and provide some food for thought for other people. And everybody has their different way, right?
Yeah.
Yeah.
You're right. And it's like, we need good detoxes like Gallus and Valiant, and we need good residential like Harmony. I love Harmony, North Star, the Foundry, some of these like places that like I'll refer to all day long because I know they're doing for the right reasons. And I got lots of friends that went to Harmony. I got lots of friends that went to Stout Street. Right?
Yes.
And that's like the end of the road place, but it's an end of the road place, right? But it does great work, and some amazing people have come out of the program. And so we need all those things. We need good outpatient treatment places like mine and like Sandstone. And we need like good sober livings like St. Paul Sober Living or Mile High Sober Living. And, we sort of have been morphing into this thing where we're keeping, here's what I believe works. Here's my personal mission. And what I believe is kind of a longer term thing, right? Like, my goal is to get people to a year. And that means we got to hold on to them for a year in sober living. And if they're not having fun and they're not growing and getting their like freedom, like, it's matched with accountability. But if they don't have that freedom, they're not going to stay for a year. And so we're doing this like, year-long program, and it's great. People are getting well. We have a lot of success, and it might not be, sexy or the most profitable model.
I think it's sexy.
It makes me feel good.
I think it's sexy. I mean, the research shows, right, if you can get to a year of sobriety, your chances of long-term, lifelong sobriety are significantly higher.
Yeah.
And I love the model because 28 days, it's not like, if you break your wrist, right, like you go to the doctor, the insurance is going to reimburse because they know that it's going to fix it. And as long as you don't, re-injure it, it'll be healed. 28 days doesn't, fix a drug or alcohol addiction or a mental health issue. It's, a long-term process, that lasts for the rest of your life. It's not a finite
No.
episode of
Right.
care. So I love the whole year-long thing, and to my understanding, it's affordable. And if a parent were to call me and say my kid's really struggling or my loved one's really struggling, what should I do? My number one recommendation would be to stay engaged with, some sort of community, or to be able to, seek some potential acute help, like going to detox. I'm certainly not against the residential model. I think that can be helpful, but you got to stay in it. You can't just go for 30 days, 90 days, and then just expect to be able to start a new life and, be good forever. It's maintenance, it's a long-term, lifelong thing.
It is, and
Sorry.
everybody needs to get help. We just had Kevin Peterson last week, and you got to get the family involved, right? We recover in families.
Yes, the family for sure.
And so it's a whole thing, right? It's not like you're just going to stop doing drugs, remove substances, and everybody's going to like skip home happy. Everybody's got to change. And it's like, I have a disease. I have substance use disorder, but I've learned how to keep it in remission. And I understand I'm going to have it for the rest of my life. That's my understanding of this disease. Some people will disagree with me. That's fine.
Yeah.
I'm going to continue to like engage in my community and have my circle of friends, my inner circle of sober people. And hopefully I will stay sober for the rest of my life.
I believe you will. I think there's just so many different factors that play into our behaviors, whether it be addictive or otherwise. But, when someone goes through a program, they, go through an assessment period, and they call it the biopsychosocial or the comprehensive diagnostic assessment. The reason why that's so important is because a trained clinician or a professional needs to understand your biological history, your psychological history, and your social history. That's what shapes you over the course of your life, and that's really what impacts who you kind of come to be. You're more or less a calculation of those different influences and factors. And then when you throw things in like trauma, right, like that really exacerbates, it can certainly exacerbate like the addiction and substance abuse and all that type of stuff. And so for some people, maybe working through some of those traumatic events will really, quell some of those cravings or addictive behaviors, whereas someone else just biologically, with kind of the poor luck of the draw, in their genetic system are just much more predisposed to the disease. And so it's just such a complex thing, and every human being is so different because we're all just a collection of these unique experiences. And I think that, there's definitely a spectrum of the disease and of addiction. And I think that we're all capable of moving on that. And I think some people biologically are in a position where they're going to just have to be sober for their life to be able to live a happy and healthy life. And the ones that are, really accepting of that, I think, and put the work in and have that community, just have amazing lives and are very inspiring people. And that's part of the reason I also love the work in this industry, is that the stories and what people have been through and everything that they've done to get to where they're at. It's just like, it's awesome.
Yeah,
I love it.
agree. And that's one thing like you share, I believe, with people in recovery is like that authenticity. My experience is I had to be authentic. I had to stop being a phony baloney and had to like getting honest. And you were just like kind of a straight shooter. You're kind of an honest guy, right? And so it's good. But I think the work you do is important. And
thank you.
I do. I think it's super important because there's a lot of people like myself. Like I have some really good qualities. One of them is not what you do. I cannot do what you do. I just can't do it.
Well, that's why I have work, because
Yeah,
not many people want to sift through 5,000 standards of compliance. But yeah, I mean, you read the mission of my company. The vision is a higher standard of quality and safety in healthcare. And that's what I believe in, more accountability. Behavioral healthcare is young compared to the larger healthcare environment, right? Which makes up over 20% of the GDP now.
Yeah.
And, 50, 70 years ago, less people cared about people that struggled with mental health and substance use issues.
Yeah.
Now, as society has developed and understands that those people are of equal value of any other person and that they deserve to be treated well and helped, just like someone that has diabetes gets help, someone that has an addiction disease needs help as well. Now, all these different stakeholders, the government, the consumers, the insurance companies are all saying, wait, what are we paying for? How are we going to start to define what a successful episode of treatment looks like, and how, this healthcare organization, behavioral healthcare organization is actually doing good work versus this one. And that's what gets me excited about our industry, is that people are starting to have those difficult conversations and applying pressure to an underregulated industry that has taken advantage of people that are suffering, more or less. And there's the trio of articles that came out in the New York Times, A Business of Addiction, I think opened up a lot of different doors for the industry for people to be like, wait, this is not really right.
I know, like, my friend Andrew Wainwright, he said, in the world of healthcare, most doctors and hospitals, they live in houses with electricity. You people that are dealing with addiction are living in a cave, rubbing two sticks together to try to start a fire. And you were just alluding to that, and like, it is a new industry, and not enough attention has been paid to, like, what are we doing? What does work? What are we trying to even get? Is it a life of being substance free? Is it a high quality life? Is it not overdosing on heroin? Is it okay to relapse if you get yourself back into recovery? Do you know what I mean?
Like, and that's what I appreciate, especially about like accreditation. The Joint Commission and CARF, they force you to really treat someone based on what their strength, needs, abilities, and preferences are, so that you're collecting information not only from them about their biopsychosocial history, but also in the treatment planning process. There's even a verbatim standard in the Joint Commission that says goals must be set in the own words of the client. And so to me, a successful execution of a treatment plan is a successful treatment episode, because this is the individual stating what they wish their life would be like, and then you're helping them to get there based on what their strengths, needs, abilities, and preferences are. And so a lot of people hire me because they need to check box in order to submit a network contract application for insurance company, or they want to get more credibility in the industry, or they won't get reimbursed out of network unless they have it. But what I try to inspire in the process is that these standards weren't just written by people that wanted to put up red tape. It's doctors, clinicians, physicians, all kinds of different experts that have said, you need to take a very detail-oriented approach to everything that you do across the course of your business in order to properly serve the individual with individualized care, which is something that most every treatment center I've ever talked to has claimed to do and be, but it's very difficult to actually pull that off and give someone an individualized treatment episode. So I'm sorry, I got off a little bit on a tangent there.
That's okay. I get off on tangents all day long. Well, we have run out of time. I want to reiterate that I do think the work you're doing is important. If you continue to work with ethical owners and ethical companies, and you help them do it, stay regulated, stay accredited. Otherwise, it's gonna just get worse, in my opinion.
Well, I think it's going to continue to get better. You see a lot of the bad players getting weeded out. Like I said, the different stakeholders are making a stronger level of attention towards, quality and safety and all that stuff. So yeah, man, I appreciate talking to you and having you. And I've got some pretty exciting stuff coming down the pike with some new innovations that I've been working on, and some expansion plans that I think will revolutionize some things in our industry and really make it easier for people to be able to maintain all those different things they have to do throughout the year to stay in compliance. And if it's more simple to do all these difficult things, then it'll make it easier to do it, and the patients will get a better experience as a result. So
Good. I like simple.
maybe on the next episode, we'll share about that stuff.
Absolutely. Parker, thank you.
Of course.
All right. See you later.
Later.